Hello everyone and welcome back to our channel. If you or someone you love is on Medicare or soon to be on Medicare, today's video is one you cannot miss. In today's video, we're going to be talking about some of those hidden costs in Medicare that many people don't know about until it's too late. But don't worry, I'm going to give you some practical tips on how to avoid some of those surprise medical bills and how to get the most out of your Medicare coverage. Let's dive right in. First, let's do a quick refresher. So Medicare is a federally run program mainly designed for those age 65 and older, but it can also assist with the medical needs of those who are younger with disabilities. Now, Medicare will cover almost everything, but here's a big but: it doesn't cover everything. There are different parts of Medicare. Original Medicare is broken down into Part A and Part B. Part A is basically your hospital insurance. It will cover your inpatient care, skilled nursing facility care, some home health care, etc. Then there's Part B, which is basically any time you see a doctor. This is your medical care. It will also cover your medical screenings, diagnostic services, lab work, etc. Now, parts that are not included under Original Medicare would be Medicare Part C, also known as Medicare Advantage. This is an alternative to Original Medicare. It's going to encapsulate all of the benefits of Original Medicare, but sometimes it will offer additional benefits not offered by Original Medicare. The downside here is that there are networks. We're going to go more in depth in just a minute. And then finally, there is Part D, because Original Medicare really doesn't cover prescription drugs, except with some very limited exceptions. So Part D is your prescription drug coverage. For many people, enrollment in Original Medicare is actually automatic. If you're already receiving Social Security or railroad retirement benefits, then you should receive your card in the mail. If not, make sure to contact Social Security. For others, you will need to actually enroll in Original Medicare, and it's very important that you do so in a timely manner. That way, you are not beholden to Medicare late enrollment penalties. So if you're not automatically enrolled, make sure you do so in the 7-month window surrounding your 65th birthday. That would be the 3 months before, the month of, and the 3 months thereafter. If you are not maintaining creditable coverage and are not enrolled during this window, then you may be subject to late enrollment penalties. For example, there is the Part B late enrollment penalty and the Part D late enrollment penalty. In all honesty, the Part B late enrollment penalty is a much bigger concern than the Part D late enrollment penalty, but you should at least be aware of both. So the Part B late enrollment penalty is basically 10% of your premium for each full 12-month period that you are without Medicare Part B when you were eligible for it. This gets tacked onto your monthly premium forever. It's not a one-time penalty. Now, the Part D late enrollment penalty is 1% for each month that you are without Part D when you were eligible for Medicare and you didn't have creditable prescription drug coverage. This is after a period of 63 days. Now, in all honesty, this could really just be a couple of extra dollars added onto your Part D monthly premium. So like I said, it's not really as big of a deal as Part B, but you should at least be aware of it. Speaking of costs, many people are actually under the assumption that Medicare is free. That's definitely not the case. In addition to those monthly premiums, we're going to be talking about some of those potential hidden costs later in the video. Part A actually usually doesn't have a monthly premium if you qualify through yours or your spouse's work history. Basically, you or your spouse need to have paid into a Medicare-covered job for at least 40 quarters, which breaks down to about 10 years, to qualify for that premium-free Medicare Part A. If you haven't, then there is a premium for Part A, and it's pretty significant. If you've worked between 30 to 39 quarters, then the monthly premium is $285 per month. If you've worked less than 30 quarters, then it's actually $518 per month. Now, the good news is, as you continue to work, you can slowly knock off those monthly premiums. So let's say you've currently worked 38 quarters. Well, as you continue to work, once you reach that 40 quarters, you will no longer be responsible for a Part A monthly premium. Part B always has a monthly premium and is actually determined by your income. So there is a base beneficiary premium, and in 2025 it's $185. However, if you are a higher earner, then you may be responsible for a larger monthly premium. But remember, Medicare is looking at your income from 2 years ago. So if you have retired and are now making significantly less, you could actually be paying a much higher monthly premium than what you should be responsible for. If that's the case, make sure to file this form over here, IRMA, that's SSA-44. I'll put that in the description below if you do need to access that form. And basically this is asking Medicare to reconsider the amount that you're paying for your monthly premium because there has been an adjustment in your income. I'm going to jump over Medicare Part C, Medicare Advantage, and get back to that in just a minute. For Part D, there are also monthly premiums, of course. This is an optional part of Medicare, but one you definitely want to enroll in. Now, many people are able to access plans with $0 monthly premiums. Those are available in many states. However, like with Medicare Part B, if you are a higher earner, there may be an additional monthly premium that you have to pay. Now, this is not the case for Medicare Advantage plans, which are a replacement for original Medicare and often encapsulate those additional benefits offered by Part D. There are many plans that are offered at $0 per month. However, you do need to continue to pay for your Part B monthly premium. Then there are deductibles and copays and coinsurance. I don't really consider these to be hidden costs. I think it's pretty much a given that when you utilize your health insurance, regardless of what type of health insurance it is, meaning Medicare or group health insurance, that there are often going to be some costs associated with these services. However, what you may not know about are lifetime reserve days, which basically means there is a cap on your Medicare benefits as far as your inpatient care or care in a skilled nursing facility. Medicare is only going to cover so many days, and after that, you'll be responsible for the entirety of the bill. And there are many things that Medicare doesn't cover, which comes as a huge surprise to many people. For example, dental, vision, hearing, and prescription drug. As we've already discussed, you can access prescription drug coverage through a Part D plan. It's not covered by original Medicare with very, very limited exceptions. For example, Part B will cover chemotherapy, certain oral anti-cancer drugs, some vaccines, insulin if it's administered via pump, etc. There are costs for these though, of course. With Part B, generally speaking, we're looking at a 20% coinsurance. And if you're talking about something like chemotherapy, that could be thousands and thousands of dollars. Original Medicare also does not cover long-term care. There's a common misunderstanding that long-term care and skilled nursing facility care are the same thing, and that's absolutely not the case. Original Medicare does cover skilled nursing facility care. However, these are facilities designed for rehabilitative or habilitative services after some type of treatment in inpatient care. If you have some type of long-term condition like dementia or Alzheimer's, you would be disqualified from skilled nursing facility care under Medicare's guidelines. For these types of conditions, something long-term, you would need a long-term care facility. That's an entirely separate type of insurance. There are also many confusing rules and regulations regarding services and treatments that actually are covered. For example, colonoscopies. Colonoscopies are considered some type of preventative screening, which should be covered with no charge. However, if something is discovered during your routine colonoscopy, it turns from a preventative screening procedure to a diagnostic procedure, and all of a sudden you are out that 20% coinsurance, which could be rather significant. And all of this happens while you're unconscious. Now, you can avoid these types of charges with a Medicare supplement plan, which we'll discuss later in the video. There can also be additional rules regarding the frequency of these types of screenings, like colonoscopies, mammograms, etc. If you schedule your regular screening too early, then it actually wouldn't be covered by Medicare and you would have to pay the full amount. But don't worry, there are ways of protecting yourself from getting these big bills. First, please get an estimate of the cost of these services before agreeing to them. Ask your provider, is this covered by Medicare? How much is it going to cost? Also, you really need to familiarize yourself with the ins and outs of Medicare. Read the documentation provided. I know it's boring and a little complicated, but it could save you hundreds or thousands of dollars. Another way to stay up to date is, of course, to subscribe to this channel. We release these videos on a weekly basis. I've got an entire Medicare playlist, which I will put at the end of this video if you want to learn more. I do highly recommend that you check that out. Of course, if you have more specific questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services, so please feel free to reach out with any questions. And of course, make sure to like this video as well so we can get this information out there. All right, let's get back to it. Now, even though some of these preventative services can be a little confusing, it's very important that you take advantage of the preventative services offered by Medicare. Catching something at an earlier stage not only would prolong your life, but it'll protect your pocketbook as well. But remember, Medicare does not cover an annual physical. It's very important that you understand that terminology because basically Medicare acknowledges 3 types of basic doctor's visits with your PCP. A welcome to Medicare visit, a wellness visit, and an annual physical. These are the 3 basic, quote-unquote, regular types of doctor's visits according to Medicare. There's the welcome to Medicare visit, the Medicare wellness visit, and routine physical exams. So you're going to see that there is a lot of crossover, and there are a lot of similarities. The differences are rather minute, but what really sets these apart additionally are the timing of them and really the purpose of them. So the first visit is the Welcome to Medicare visit, which is, of course, your welcome visit. Now, this must be completed within the first 12 months of enrolling in Medicare Part B. During this visit, you will review your medical and family history. Your doctor will take some routine measurements such as height, weight, blood pressure. You'll go over your list of doctors and prescription drugs. Your doctor will schedule preventative screenings with you. He or she will look for any signs of impairment, dementia, memory loss, signs of frailty, and you'll go over your health risk assessment, which is basically a questionnaire. Then there is a Medicare wellness visit. This visit is very similar to your Welcome to Medicare visit. However, this one comes down to the timing. So, a Medicare wellness visit is after you've been enrolled in Medicare Part B for at least 12 months, and it cannot be within 11 months of your last Medicare wellness visit, or it won't be covered, because both your Welcome to Medicare visit and your Medicare wellness visits are completely covered by Medicare. Again, you're going to review medical and family history, take those routine measurements, go over your list of doctors, possibly update them. You'll schedule your preventative screenings, you'll do cognitive wellness exams, and your doctor will put together, any type of medical advice that they feel is necessary based on your current health. And then there are physical exams. These are not covered by Medicare. And these are really meant if something's bothering you, something that you might go to the doctor for if you're sick, if something's bothering you. Again, you'll review medical and family history, routine measurements. They're going to assess your risk factors based on your health. They're going to do a physical exam of your lungs, head, neck, brain, your abdomen, whatever it is that is bothering you. They'll test your reflexes and your vital signs and send out for blood work or urine analysis. And these tests are all going to be billed individually. So this is the type of regular exam, quote unquote, that's not really covered by Medicare. So you will have to pay for some portion of it, and again, all those tests individually. Now, if you want to get the best bang for your buck, let's talk strategy. As I mentioned earlier in the video, there are some out-of-pocket costs. Something extremely important with Original Medicare. There is no out-of-pocket maximum. That means there is no limit on your yearly medical spending. Should you have major and possibly ongoing medical needs, something like a cancer diagnosis, you could be responsible for thousands and thousands of dollars in medical bills with no cap on that spending. To provide additional protection, you may want to consider a Medicare supplement plan, also known as a Medigap plan. These types of plans will fill in those financial gaps of Original Medicare. Basically, you select a plan, you pay an additional monthly premium, but that plan will help to cover or possibly entirely cover the deductibles and copays and coinsurance of Original Medicare. These plans can also impose an out-of-pocket maximum to provide additional protection. The good things about these plans is that the benefits are standardized, so it's very easy to select a plan. And of course, if your doctor accepts Original Medicare, and almost all do, then they accept your Medicare supplement plan. This is really just a financial solution. Think of it as more of an all-inclusive approach to healthcare. You could also opt for a Medicare Advantage plan. Remember, this is an alternative to Original Medicare. Many people get Medicare supplement plans and Medicare Advantage plans confused, which is entirely understandable. However, they really are entirely different. So Medicare supplement plans, as I mentioned, will sometimes impose an out-of-pocket maximum. Medicare Advantage plans will always impose an out-of-pocket maximum. With Medicare supplement plans, there may be medical underwriting. If you enroll outside the initial 6-month window when you first turn 65 and become eligible for Medicare and enroll in Part B, should you choose to enroll outside of that window, you may be subject to medical underwriting, which means you could be charged more or denied completely. There is never any medical underwriting with Medicare Advantage plans. As I mentioned, your benefits, meaning your out-of-pocket costs with Medigap plans, are standardized. With Medicare Advantage plans, those benefits and costs vary widely. Now, there are no additional benefits offered by Medicare supplement plan. They're just a financial solution to those out-of-pocket costs. However, many Medicare Advantage plans will offer additional benefits to entice potential beneficiaries, things like dental, vision, hearing, prescription drugs, maybe fitness, transportation, etc. Now, on to some of the more positive aspects of Medicare supplement plans, because they really are our favored alternative. Medicare supplement plans, because they are just a financial solution, there is no pre-authorization, there are no networks. If your doctor accepts original Medicare, they will accept your Medicare supplement plan. With Medicare Advantage plans, there are networks. Those networks can be extremely restrictive. Additionally, these plans will require pre-authorization. That means that between you and your doctor and your treatment plan stands your insurance carrier. They first have to pre-authorize any service or treatment, and this can lead to delays and possible denials. If you choose to go for a Medicare supplement plan, please make sure to enroll during that 6-month window to avoid medical underwriting. If you want to go for Medicare Advantage plan, then you want to enroll during the AEP, which is every year from October 15th to December 7th. And if you need to make any changes, you can do so during January 1st to March 31st. Regardless of what type of Medicare coverage you have, make sure to review your plan every year and make sure to set an appointment with your broker. We do expect that there are going to be some pretty big changes coming to Medicare in the coming years. I've got a video here that's going to go more into detail, and of course that Medicare playlist that I mentioned. If you have any questions, you can reach us in the comments below or at the number on the screen. We are licensed nationwide and there's no charge for our services. And please make sure to like this video and subscribe to stay up to date. We'll see you next time.